Hello, everyone. Welcome to my channel. Today we will talk about chronic kidney disease in full detail. If you have any question about chronic kidney disease, then watch this video and you will get all the answer. This video is very important, so do not skip any part of the video. Let's go to the main topic of the video. What is chronic kidney disease? Your kidneys have been damaged and aren't functioning as well as they should if you have chronic kidney disease. XD, also known as chronic renal disease. Your kidneys function as a sort of filter in your body, removing surplus water, poisons, and waste from your blood. Additionally, they support the health of the bones and red blood cells. When your kidneys start to fail, they are unable to filter waste, which causes the waste to accumulate in your blood. Because kidney function gradually deteriorates over time, kidney disease is referred to as chronic. Renal failure, commonly known as end-stage renal disease, can result from CKD. Although kidney failure does not occur in every case of CKD, the condition frequently gets worse without therapy. The chronic renal condition is incurable. You can, however, take measures to minimize kidney injury. Dialysis and kidney transplantation are two possible treatments for renal failure, end-stage kidney disease. How do your kidneys function? You have two kidneys. They are bean-shaped organs that are situated towards the base of your rib cage on either side of your spine. The size of each kidney is around that of your fist. The primary function of the kidneys is to cleanse your blood by expelling waste products, poisons, and extra water as urine. Your kidneys also produce hormones that regulate blood pressure, generate red blood cells, keep your bones strong, and maintain the balance of minerals and electrolytes, such as salt and potassium. In your body, wastes can accumulate in your blood and cause illness if your kidneys are damaged and not functioning properly. Kidney stages. Chronic kidney disease has 5 stages. The stages are determined by how effectively your kidneys can remove waste from your blood. Your stage of KD is determined by blood and urine testing. Stage 1. Although your kidneys are healthy, there are slight indicators of impairment. Stage 2. Although your kidneys are functioning normally, there are more indicators of slight renal injury. Stage 3. Your kidneys are showing mild to severe impairment and aren't functioning as well as they could. The most typical stage is this one. At this point, symptoms can start to appear. Stage 4. Your kidneys are highly damaged and on the verge of failing, and as a result, you have very low renal function. Stage 5. Your kidneys are either already failing or extremely close to doing so. At this point, you might require kidney dialysis or a kidney transplant. How prevalent is this illness? In the U.S., about 15 of adults suffer from chronic renal disease. The number of Americans with chronic renal disease is about 37 million. Symptoms. In the early stages of kidney disease, you usually don't have noticeable symptoms. As the disease worsens, symptoms may include a greater urge to urinate, weakness, poor energy, and fatigue, decrease in appetite, your hands, feet, and ankles swelling, respiration difficulty, bubbled or foamy urine, swollen eyes, skin that is dry and scratchy. I have trouble focusing, difficulty sleeping, numbness, vomiting or nauseous, muscle pain, elevated blood pressure, skin color changes. Remember that it may take several years for waste to accumulate in your blood and manifest as symptoms. How do you feel when your kidneys are not functioning properly? In its early stages, kidney disease frequently shows no symptoms at all. The first indication that something is wrong once you start experiencing symptoms may be swelling in your hands and feet, itchy skin, or a need to urinate more frequently. Since symptoms can differ, it's essential to phone your doctor if you think there's a problem. Does kidney disease run in families? Yes, genetic families can carry a gene for kidney disease, like diabetes. Mixed risk factors frequently run in families. Risk factors. A chronic kidney illness can strike anyone. Chronic renal disease is more likely to affect you if you possess diabetes, blood pressure is high, have a cardiac condition, have renal disease running in your family, possess an abnormal kidney size or structure, are older than 60. Complication of chronic kidney disease include anemia, a low level of red blood cells, weak and fragile bones, gout, acidosis of metabolism. This is an acid-base imbalance in your blood brought on by a decline in kidney function. Elevated blood pressure. Stroke and heart attack risk are both enhanced by heart and blood vascular disorders. Nerve harm. High potassium levels, hyperkalemia, which impair the proper operation of your heart. Hyperphosphatemia or high phosphorus. High infection risk because of a compromised immune system. The accumulation of fluid causes the feet, ankles, and hands to enlarge. Diagnose. Your healthcare practitioner will first gather information about your medical history, perform a physical examination, inquire about any drugs you're taking at the moment, and inquire about any symptoms you've experienced. To assess kidney function, your doctor will request blood and urine tests. Specifically, the blood tests will check your GFR, short for glomerular filtration rate. This information reveals how effectively your kidneys filter blood, or how many milliliters per minute they do so. Your kidney disease's stage can be identified using your GFR, your serum creatinine level, which indicates how effectively your kidneys are eliminating this waste. Creatinine is a byproduct of muscle metabolism that is often eliminated in urination. A high blood creatinine level indicates that your kidneys aren't working effectively enough to eliminate it through urination. A urine test will check for blood and protein, albumin, in your poop. Normally, healthy kidneys shouldn't have either. Imaging tests, such as ultrasound, magnetic resonance imaging, MRI, or computerized tomography, ECG scans, may also be performed as additional examinations to check for issues relating to the size and shape of your kidneys. A kidney biopsy may also be required by your doctor to rule out a particular form of kidney disease or to assess the degree of kidney damage. That is enough for today's video. In my next video, I will explain how chronic kidney disease are treated. If you have any question, you can message me on Instagram. Thanks for watching.